Hi, my name is Dr. Jennifer Moore. I'm the Associate Director of Clinical Excellence with Sovereign Health. Today I would like to talk to you about psychopharmacology, which is the science of medications. As you know, most of our patients come in with medications or are prescribed medications by our physicians in order to treat their symptoms. It is important not only for medical staff, but also for clinicians and everyone else who is treating our patients to be aware of medications, what they do, their side effects, and their beneficial effects. Looking at a patient's medication will also allow you to diagnose symptoms that they might suffer from. To begin with, I would like to look at what kinds of medications there are and which are most frequently prescribed by our physicians. Medications generally are used to treat symptoms or illnesses. In psychiatry, the most frequently used medications are antidepressants, which, as the name says, treat depressive symptoms, major depressive disorders, or other mental illnesses. Then there are medications to treat bipolar disorder. Bipolar disorder can manifest in either manic or depressive symptoms, and therefore there are medications to treat both. Anti-psychotics are used to treat psychotic symptoms such as hallucinations or other psychotic symptoms. They are also used to treat schizophrenia. Tranquilizers or benzodiazepines are used to treat anxiety, as well as they are used before surgical interventions to calm patients down. Generally speaking, tranquilizers or benzos are medications that calm patients. Then there are medications that are used to treat addiction, which you will find in our patient population. As you will know, a large group of the overall population is suffering or will suffer once during their lifetime from depressive symptoms or a major depressive disorder. Therefore, antidepressants are an important key player in the psychiatric medication field. There are multiple medications out there which are used and prescribed frequently. On this slide, you will see the most common kinds that are out there and that are important to know of. Firstly, there are selective serotonin reuptake inhibitors, or short SSRIs. Then there are Mayo Inhibitors. Mayo stands for monoamino oxidase, which is an enzyme. Serotonin and norepinephrine reuptake inhibitors, or SNRIs, are very frequently prescribed as well. Also, there is a small group of others, which I will cover later on in this slideshow. To begin with, I would like to cover the selective serotonin reuptake inhibitors, or short SSRIs. Serotonin is known to play a major role in the regulation of mood, sleep, and appetite, contributing majorly to feeling well balanced. As you will all agree, sleep, appetite, and mood impact our well-being on a daily basis. The theory is that SSRIs limit the reabsorption of serotonin in the synaptic cleft, increasing its availability. In the non-depressed brain, serotonin is released into the synaptic cleft, where it stays available for a certain period of time and is then reabsorbed into the nerve cell. In the depressed brain, that mechanism is thought to be disturbed, therefore leaving serotonin available for a shorter period of time. SSRIs are believed to make it available for a longer period of time, alleviating depressive symptoms. The exact mechanism, however, is still unknown. SSRIs are widely prescribed both by psychiatrists as well as general practitioners. This fact is due to their wide availability for symptoms and also their low risk of side effects, which I will cover later on. Examples of SSRIs are citalopram, escitalopram, sertraline, paroxetine, fluvoxamine, and fluoxetine. The most commonly known one is probably Zoloft, which is sertraline. Even though SSRIs were developed and are most frequently used for depressive disorders, they can also be used for other symptoms or other illnesses. Major depression is, of course, the major indication to prescribe selective serotonin reuptake inhibitors. However, many of them are also efficient in OCD, obsessive compulsive disorder, PTSD, post-traumatic stress disorder, anxiety disorders, as well as eating disorders. The prescribing physician will pick the most appropriate selective serotonin reuptake inhibitor for the patient to address the major symptoms adequately. As with any drug, there are not only beneficial effects, but also adverse effects or side effects. It is important for you to know what the side effects can be, because the patients will tell you about it. It is important to take their complaints seriously. However, if you know what the adverse effects can be, you can address with your patient right away. It is also very important for you to know that all psychiatric medication is not like a pain medication. That means it does not show effects within a couple of hours. It takes a couple of days to weeks. Many patients and families are not aware of that and understandably upset if the desired effect does not show within the first couple of days. This is where it is important for all clinicians and medical staff, as well as everyone else treating our patients, to reassure the patient that it will take a couple of days for the medication to be effective. However, in this slide, I would like to cover the adverse effects of SSRIs, which are important to know as some of them can be dangerous and need medical attention. A frequent side effect can be tachycardia, which means the fast beating of the heart, leading up to heart attacks, arrhythmia, and cardiac arrest. Those side effects are very seldom, however, need to be addressed if the patient complains about them. The cardiac arrest can be caused due to a prolonged time of repolarization of the heart. That means that the stimulus that is used to create a heartbeat will take longer to travel back to the beginning of the heartbeat. Another important side effect is sexual dysfunction. As you will understand, this is not an easy topic for our patients to discuss with us. However, it is important to listen to the complaints the patient might have about that, as this will go away if the medication is discontinued. Loss of appetite, as well as nausea, diarrhea, and sweating are also or can also be side effects of SSRIs. Insomnia is another side effect that can frequently be observed. As I have said before, serotonin is important to regulate sleep. Therefore, if serotonin is made available for a prolonged period of time, that can lead to insomnia. Agitation and increased risk of bleeding are minor side effects of SSRIs. For you as clinicians, it is important to know that in the first few weeks of starting on a new SSRIs, the suicide risk may be increased. This is because during the course of treatment with SSRIs, the activity level will increase first before the mood increases. That leads to a patient who is suffering from major depressive disorder or depressive symptoms with an increased level of activity. Please do keep in mind that these side effects or adverse effects do not happen very often. Those drugs are usually safe to use. However, it is important for you to know what the side effects can be. Unfortunately, not all of our patients are medication compliant. Therefore, it is important for you to have heard about the Ssri Discontinuation Syndrome. This syndrome appears when the patient stops the medication without a taper or too fast of a taper, which can also be caused by the physician prescribing too fast of a taper. It needs medical attention. The symptoms are flu-like symptoms like headaches, sweating, fatigue, nausea, and vomiting, as well as vertigo and dizziness. The patients who have experienced this discontinuation syndrome have also described brain zaps, and mood disturbances and agitation. It can be treated very easily and is not fatal. However, it is important to know what is going on. So if a patient tells you that they recently stopped their Zoloft or another Ssri and complain about those symptoms, it is important for you to alert medical staff right away so the symptoms may be addressed without. A more severe problem that might occur during the treatment with Ssris is the Serotonin Syndrome. This is a medical emergency and can potentially be fatal. It is very important to be aware of this syndrome. It is caused by the combination of multiple serotonergic drugs, which include Ssris, other antidepressants, but also illegal substances such as cocaine and ecstasy. It leads to excess serotonin in the central nervous systems. As we have discussed before, Ssris make serotonin available for a longer period of time. If another serotonergic drug is added, that increases the level of serotonin in the synaptic cleft. The onset is usually within 24 hours of extra serotonin. For example, a patient starts a new Ssri and then uses drugs outside of treatment. The symptoms are high body temperature, muscular symptoms such as a tremor, which is a slight shaking of the hands, and increased reflexes. Gastrointestinal symptoms like diarrhea, nausea, vomiting, as well as severe agitation. Seizures and arrhythmias can happen. The syndrome is potentially fatal and needs medical attention right away. If you have a patient experiencing that, who is telling you that they might have been started on a new medication might have been added, or they might have been using drugs outside of treatment, please alert medical right away so that can be addressed with no. Common brand names for Ssris are Zoloft with the generic name sertraline, Prozac, which is fluoxetine, Celexa, which is citalopram, Lexapro, which is escitalopram, Paxil, which is paroxetine, and Luvox, which is fluvoxamine. We will now move on to the next group of antidepressants. The next group I would like to cover are the Mayo Inhibitors. Those are a smaller and older group. However, they have severe interactions, which is what makes it important for you to know about them. Mayo stands for monoamine oxidase, an enzyme that breaks down tyramine. Tyramine is an amino acid which is connected to relieving depressive symptoms. The Mayo inhibitor stops that enzyme, leading to more tyramine and consequently relieving depression. As I have said, this group is older yet very effective. It is important for patients to adhere to a strict diet that contains no tyramine in order to keep the tyramine levels normal. Dietary mistakes can be fatal due to increased blood pressure. Tyramine is high in, for example, alcoholic beverages or aged cheese, as well as salamis and other cured meats. There is a very high risk of interactions with prescribed as well as over-the-counter drugs. Interactions with this group may be lethal. Mayo inhibitors may be used for major depression or other depressive symptoms, certain phobias, Parkinson's disease, anxiety, as well as bipolar depression. As I have said before, Mayo inhibitors come with certain risks and dangers. However, they are very efficient and patients might come in with them from a physician who has prescribed it to them before they enter treatment. Mayo inhibitors may have severe interactions with many other drugs, not only prescription but also over-the-counter medications. As I have stated before, the patient has to adhere to a very strict diet. If they don't, mistakes can be fatal. Some Mayo inhibitors are irreversible. That means that side effects or adverse effects can occur up to 2 weeks after the medication has stopped. That means if a patient is not aware of that, they stop their Mayo inhibitor and start a new drug, side effects might still occur. A mild phase of withdrawal is to be expected. Common names are Yatrozome and Ororix. Another large group of medications are the serotonin and norepinephrine reuptake inhibitors, or short SNRI. The mechanism is very close to the Ssri mechanism. As the name suggests, those medications inhibit not only the reuptake of serotonin, but also of norepinephrine in the synaptic cleft. They are used for the treatment of major depression or clinical depressive symptoms, anxiety disorders, OCD, ADHD, neuropathic pain, fibromyalgia, and menopausal symptoms. The first SNRI to be approved by the FDA was venlafaxine, also known as Effexor. It is still the most commonly used SNRI. It is used for major depression, chronic pain, and generalized anxiety disorder, GAD. In lower doses, it affects only serotonin receptors. At moderate doses, it affects both serotonin and norepinephrine receptors. High doses can also affect the dopamine receptor, which adds a third transmitter to its spectrum. Venlafaxine, also known as Pristiq, is the active metabolite of venlafaxine and also available in tablet form. Duloxetine, which is also known as Cymbalta, is used for depression and neuropathic pain, as well as generalized anxiety disorder. Milnacipran and levomilnacipran are also effective in treating depression and symptoms of fibromyalgia. The adverse effects are very close to the SSRI adverse effects. SNRIs are generally safe medications. In the next few slides, I would like to cover other antidepressants that are older and less frequently used. However, it is important to have heard about them. Tricyclic antidepressants, TCAs, such as amitriptyline or clomipramine, have been on the market for a very long time and are nowadays hardly prescribed. They do have good effects on mood disorders as well as chronic pain. Due to their enzymatic metabolism, they interact with many other drugs. An overdose of these drugs can potentially be fatal, and patients have to be monitored regularly to ensure the right dosage of the medication is taken in order to avoid accidental overdose. Trazodone is a serotonin receptor antagonist and reuptake inhibitor. It has an anti-anxiety and mood-altering effect. It can also be used for insomnia. Mirtazapine is used to treat major depression, but also has an anxiolytic and hypnotic effect. That means it can also be used for insomnia. It increases appetite and might lead to weight gain. Agomelatine or valdoxan is a melatonergic antidepressant with a low risk of side effects. It is also believed to improve insomnia. This slide finishes our overview of antidepressants. We will now move on to medications used to treat bipolar disorders, also called mood stabilizers. First of all, there is lithium. Then there is certain anti-seizure medication which can be used as a mood stabilizer, as well as certain antipsychotics and certain antidepressants to treat bipolar depression. With the use of antidepressants, it is very important to not go from a depressive symptom to a manic symptom. As with the antidepressants, those drugs usually take a few days to weeks to be fully effective. First off, I would like to cover lithium, which is a very well-known drug for the treatment of bipolar disorder. Lithium is used for the treatment of bipolar disorder, but can also be used for the treatment of therapy-resistant depression. A therapy-resistant depression is a depression that has been treated with more than 2 antidepressants without enough relief of symptoms. Lithium has been proven to decrease the risk of suicide. The mechanism is unknown, but studies prove its efficiency. It requires regular check of blood levels due to toxicity. Lithium overdose symptoms are nausea, vomiting, as well as diarrhea, seizures, coma, lethargy, frequent urination, and tremor. Too high lithium levels can also lead to vision impairment. It is very important for patients to get their lithium levels checked regularly, as the daily dose depends on those levels, and it is important to avoid overdose and toxicity. Medical attention is required if overdose symptoms occur. There is no standard dosage, it depends on the lithium levels, which should be drawn at least every month. As I said before, certain anti-seizure medications can be used as mood stabilizers, both for manic or depressive symptoms in bipolar disorders. Those are valproate, also known as Depakote, carbamazepine, also known as Tegretol, lamotrigine, also known as Lamictal. All bear risk of seizures when stopped abruptly. It is therefore important to taper those medications in and out in order to avoid any complications. These medications might also require blood level checks as well as regular blood checks in order to avoid any effect on the hematology system. Apart from anti-seizure medications, also antipsychotics might be used to treat bipolar disorder. Most antipsychotics used to treat those disorders have a good effect on manic symptoms. Seroquel can also be used for bipolar depression as it has a mood-altering effect. Drugs that are mainly used to treat manic symptoms and their relapse are Abilify, Zyprexa, Seroquel, and Risperdal. Please do keep in mind again that those medications take a few weeks to be fully effective in the patient, as blood levels need to be achieved. On rare occasions, certain antidepressants might be used to treat bipolar disorders. This will happen when the depressive symptoms are predominant. It is important, however, to know that this increases the risk of triggering a manic episode. Antidepressants may be combined with other mood stabilizers in order to avoid that side effect. The next major group of medications we want to look at are the antipsychotic or neuroleptics. This group of medication is used to treat psychotic symptoms or schizophrenia. They may also be used in the treatment of bipolar disorder. Some might be used to treat depression, such as Seroquel. Long-term use can be associated with involuntary movements, metabolic syndrome, and apathy. Metabolic syndrome is qualified as weight gain as well as the development of a type 2 diabetes and other intestinal symptoms. The first generation are also called the typical antipsychotics or neuroleptics. The second generation are called the atypical antipsychotic and neuroleptics. I will talk about each group later on in this presentation. Antipsychotics mainly affect the dopaminergic system. However, their concrete mechanism is still mainly unknown. To begin with, I would like to tell you about the typical antipsychotics. This group of drugs was developed in the 1950s. They block the dopamine receptor in the brain. That can cause Parkinson-like body movements, dry mouth, muscle stiffness, cramping, as well as weight gain. The most famous of these drugs is probably Haldol, with the generic name haloperidol, which can be given orally or as an injection. Next group we want to look at are the atypical antipsychotics. They were developed later on than the typical antipsychotics. They also block the dopamine receptors, however, have a different spectrum than the typical antipsychotics. Those medications can be used as add-on for the treatment of major depression as well. Parkinson-like movement disorders are less likely in this group than they are in the first generation. However, movement disorders remain a severe side effect of atypical antipsychotics, especially in long-term use or with high doses. Atypical antipsychotics are also used to treat dementia, anxiety disorder, and OCD. The treatment of OCD with atypical antipsychotics is off-label. That means it has not been approved by the FDA. Please, again, do keep in mind that those drugs take weeks to months to be fully efficient in our patients. Please help the patient and families understand that this is normal and is not a sign of treatment failure. The drugs commonly used as atypical antipsychotics are Abilify, Seroquel, Risperdal, Zyprexa, Invega, Zeldox, and Clozaril. Clozaril is a special case as it requires frequent blood draws to make sure that the blood cells are not impaired by the drug. The physician will advise the patient on what to do. Many of these drugs are also available as intramuscular shots. However, that is not always necessary. Similar to the Serotonin Syndrome with Ssris, there is a syndrome that is important to know about for patients who are treated with antipsychotic. It is called the Neuroleptic Malignant Syndrome and can potentially be life-threatening. The symptoms are muscle stiffness, fever, unstable blood pressure, which means the blood pressure goes up and down unpredictably, as well as delirium or coma, muscle cramps, and tremors. It is usually caused by antipsychotic drug use, but can also happen after a rapid increase in dosage. For example, Risperdal is being augmented from 2 mg to 8 mg. This is a medical emergency and needs to be treated right away. The prognosis is best when treated early. Please do take your patients seriously when you know they are on antipsychotics and complain about those symptoms, as it needs to be treated right away. The next group of medication I want to look at are tranquilizers or benzodiazepines. Those medications have various effects that also come with some sort of addictive potential. They are sedative, that means calming, hypnotic, which means helping you to sleep, anxiolytic, which means resolving anxiety, anticonvulsant, which means anti-seizure, and muscle relaxant. They are used for the treatment of anxiety, agitation, insomnia, muscle stiffness, seizures, alcohol withdrawal, and as a premedication before surgery. Long-term use leads to physical dependence. There is a risk of fatal overdose when combined with alcohol or other sedating drugs due to the breath sedating effects those drugs can have together. The patient might just stop breathing. Adverse effects are drowsiness, dizziness, lack of alertness, cognitive impairment after long-term use, which can be proven by cognitive testing. Benzodiazepines, or short benzos, are widely known. The most commonly used drugs are clonazepam, also known as Klonopin, lorazepam, also known as Ativan, oxazepam, diazepam, which is also Valium, and alprazolam, which is known as Xanax. Apart from benzos, are there sedatives that might be worth knowing about? Zolpidem, which is also known as Stilnox or Ambien, is used for the treatment of insomnia. Luminal is also used to treat insomnia. So is Zopiclone, also known as Imovane. During your work with our patients here at Sovereign, you will most likely come across patients suffering from addiction to alcohol, opiates, or other drugs. There is medication available to help ease the patient's process through the withdrawal and to help them stay sober. Acamprosate or Camprel is used for the treatment of alcohol addiction. It antagonizes a neurotransmitter that is very active during alcohol withdrawal. It can lead to allergic reactions as well as unstable blood pressure. However, it helps the patients stay sober. Naltrexone, also known as Vivitrol, is an opioid receptor antagonist, and it decreases the cravings during withdrawal. It is used for opiate withdrawal and can also be used to keep the withdrawal up after the detox. Suboxone, which is a combination drug of buprenorphine and naloxone, is also used to taper patients off opiates. You will see this drug used very frequently during the first episode of care, which is the detox episode of care. Your patient will usually receive a 7 to 14-day taper, depending on their clinical presentation. In some cases, benzos might be used during detox in order to help the patient throughout the first withdrawal phase. Antabuse is a medication that is used to help patients stay off alcohol after detoxification of alcohol. They stop the destruction of acetaldehyde, which leads to major discomfort when alcohol is consumed, which stops the patient from consuming alcohol. Lastly, it is also good to know about Lyrica, which is pregabalin. It is used for epilepsy, pain, generalized anxiety disorder, and can cause sleepiness, confusion, weight gain, and trouble with coordination. Even though it is not per se addictive, it has some addictive potential, and that comes with a certain potential for misuse. It is important for Lyrica to be tapered in and out appropriately in order to avoid side effects, which can include seizures. With this, I would like to end our short overview of the medications we use. Please always be mindful about any side effects, and please do take your patients seriously when they complain about any new physical symptoms after they started or stopped the medication. Many of our patients are on more than one drug, and it is therefore important for the whole treatment team to keep an eye out on the well-being. Lastly, please do not hesitate to contact a medical staff member should you have any questions about medications. We are always happy to help and answer questions. Please pause the presentation here and refer to the vignettes that the course leader will give to you. Thank you for your attention.